Hello, my name is Andrew Adeyiga, and I'm a second-year medical student at the University of Central Florida College of Medicine. Welcome to my presentation, and today we'll be talking about an in vitro cartilage injury model used to study the drug effects on the type 2 collagen response. Osteoarthritis is a disease involving the gradual deterioration of articular cartilage in joints due to mechanical wear and aging. Osteoarthritis can also be induced due to joint injury, as seen in athletes, and this is called post-traumatic osteoarthritis. Post-traumatic osteoarthritis can occur after injuries such as the ACL tear, and the concentrations of inflammatory cytokines such as interleukin-1 beta, tumor necrosis factor alpha, and matrix metalloprotease 1 and 13 can increase to maximum levels around the joint. These cytokines can induce chondrocyte apoptosis and ECM degradation, and these sustained conditions can lead to cartilage degradation. In a previous study conducted by a group, three drugs were identified from a natural drug screen to stimulate type 2 collagen production within a non-inflammatory environment. These drugs are aromoline, deserpidine, and ABT-724. In this study, we want to see what these three drugs do within an inflammatory environment. In this study, we used neonatal chondrocytes, which were engineered to secrete a type 2 collagen luciferase reporter. Chondrocytes were seeded into plates at a density of about 50,000 cells per well and centrifuged to form cell aggregates or pellets. These cell aggregates were cultured in chondrogenic media in different combinations of interleukin-1 beta, aromoline, deserpidine, and ABT-724 to comprehensively examine the effects of these drug compounds. Over 22 days, the media was sampled and changed every 2 days, or 2 to 3 days. The luminescence was measured. Pellet images were also taken. On day 22, the cell aggregates were split for a matrix metalloprotease assay. And below here, you can see the treatment schedule. So there were four treatment groups. The first treatment group simulates a non-inflammatory environment where drugs were added at the beginning of the experiment, but no interleukin-1 beta was added. In treatment group B, drugs were introduced at the beginning of the experiment, and interleukin-1 beta was added at day 10 to simulate constant inflammation with prophylactic drug uh, input. In treatment group C, drugs and interleukin-1 beta were both introduced at day 10 and removed at day 12 to simulate acute injury and treatment. And in treatment group D, drugs and interleukin-1 beta were both introduced at day 10. However, only interleukin-1 beta was removed at day 12 to simulate acute treatment with sustained injury. So over the next couple of figures, I just wanted to outline that the red line serves as our control for each of the figures. But in this figure, this is the time course expression of the type 2 collagen reported to us by luciferase. So the most notable graphs in this one would be A and B, which just verifies what was found in the previous study, that aromoline was that can stimulate type 2 collagen. However, there's no clear trend once you look at the inflammatory side of this project for these figures. There's no clear trend or that clearly states that any of these drugs give any protective benefit. This figure shows us the time course for our cartilage aggregate size. The most notable graph here would be graph A, which showcases a trend of deserpidine giving us larger pellet sizes, at least up until the day 21 mark, where aromoline gives us a larger pellet size. However, this is also in a non-inflammatory environment without interleukin-1 beta challenge. The other graphs don't really showcase any significant or clearly delineated trends. And in our final figure, we have the time course expression of active MMP and cartilage aggregates. The most notable graphs in this figure would probably be C and D because they show significant decreases in MMP levels after interleukin-1 beta challenge. And D is particularly cool too because it shows that with prolonged drug interaction and day 16, active MMP levels were also significantly decreased. So to recap, Romaline doesn't appear to clearly exhibit a protective trait within an inflammatory environment, but is verified it can do so it can stimulate type 2 collagen in a non-inflammatory environment. And active MMP levels were lowered with drug stimulation, particularly with prolonged treatment. And lower levels of MMP can indicate less degradative processes ongoing and perhaps potential for therapeutic intervention with prolonged treatment. So the combination of these two findings can definitely contribute to our knowledge of treating osteoarthritis and maybe even post-traumatic osteoarthritis as well. Further trials should be conducted to just take a better look at the data and to identify any other trends and to make some more comparisons as well. Thank you.